Good morning, everyone. My name is Christina Van Sickle, and I'm the Director of Professional Practice at the College. I'd like to thank you for joining us for this keynote discussion panel, Touchpoints of Trust, Setting Boundaries and Navigating Consent. Please note that this panel discussion may include information about sexual abuse and systemic and structural racism and oppression. Please take care while watching this discussion and seek support if needed. Before I introduce our panelists for today's session, I'd first like to go over a few housekeeping items. If you require assistance, there is a help section for tech support at the bottom left-hand corner of your screen. You can click on the help icon to connect with our live support. There will be an opportunity to ask questions at the end of the panel. You can submit your questions through the chat feature on the right-hand side of the session page on the virtual portal. Questions will be read aloud for the presenters to respond. Now let's begin our panel discussion. I'm pleased to introduce you to all of our panelists. Constantine Cabrios is a social worker with extensive experience in the mental health field, immigration and settlement communities, HIV/AIDS sector, and post-secondary institutions. He currently works at CAMH Rainbow Services and in private practice. Alistair Smith is a patient advocate with a public policy background. He brings lived experience of navigating the world and health systems as a trans man with multiple chronic health conditions. Melanie Tibishko-Jishik is a social worker who's been in the mental health field for over 30 years. She currently works in private practice, along with a few colleagues in the process of starting an Indigenous mental health organization with various services being provided by Indigenous mental health providers. Yichin Chua is a social worker with extensive experience working with children, youth, parents, and adults in settings including children's mental health, community health care, private practice, and education. She currently works as a counselor supporting racialized students in post-secondary settings. You can read the full biographies of our panelists on the virtual portal. Please join me in welcoming our panelists. Thank you. So, before we launch into our conversation today, I just wanted to set a little bit of context for why we're having this discussion. As many registrants will know, over the past 3 years, the college has seen a disturbing rise in the number of sexual abuse-related complaints. As part of the college's public protection mandate, a multi-pronged approach is being developed to address this issue, including implementing a mandatory sexual abuse prevention program, or SAP for short, that all registrants are going to need to complete as part of their annual 2025 Continuing Competence Program. So again, just want to highlight the fact that this is for next year. I know we're all doing our renewals right now, but this is going to be something that we need to consider for our 2025 CCP. So don't worry, you'll hear more information about that in the new year. As part of developing the SAP, the college engaged the Citizens Advisory Group, which is called the CAG for short. And this is an insightful and invaluable committee that really helped us in shaping the content of the SAP. It's a group that represents the patient and caregiver voices in healthcare regulation in Ontario. And so the SAP outlines that in the standards of practice, registrants are prohibited from any form of physical contact which is not necessary to the helping process. Additionally, the standards of practice state that college registrants shall not engage in behavior or remarks of a sexual nature toward the client, other than remarks or behavior of a professional nature appropriate to the services provided. So members of the CAG raised important questions about these interpretations in the standards of practice. They asked how a registrant can determine when physical contact or behavior or remarks of a sexual nature is necessary to the helping process and is appropriate to the services provided. These questions highlight the need for further exploration of consent and boundaries in registrant-client relationships, both in terms of sexual abuse and the topics of consent and boundaries in general. So the answers to these questions necessitate in-depth conversations about consent and boundaries, and they're topics that may be overlooked in academic or practice settings. In today's session, we're going to start by broadly exploring these themes before narrowing our focus on the questions posed to the college by the Citizens Advisory Group. I'm thrilled to be facilitating this panel discussion today, and we're going to delve into these important topics. So our first question today is what are the most important things to consider when initiating conversations about boundaries and consent with clients? And I'm going to start with Constantine and then go to Melanie and then I Ching. And then Alistair, I've got a question specifically for you afterwards. So Constantine, are you okay to start us off?
Okay. Again, I think it depends on your practice setting, the population that you work with, your lived experience, and also the context of where the client is at. Having these conversations, and again, I think I'm going to speak to the population because there's a certain permission structure when you have a familiarity with a client or clients or the community that you come from, represent, and serve at the same time. So there's a lot of navigating multi-layers of communication and understanding of what service we're providing and what the client's needs are. That's very broad, but I think those are very important things to consider before we even have a conversation, because it's about the language and understanding of what boundaries mean and consent. And again, it's based on the lived experience of both the clinician and the service user.
That's great. Thank you.
Bonjour, Saigon. For me, in discussing boundaries and consent starts right from the first meeting. I feel that setting those boundaries, having those consents, being upfront with everything right from the beginning is very important in that helping relationship. So for me, it's putting it out there right away so that there is no fears or no discrepancies, no should I say this, should I say that. So I try to put it out there on the table right away, establishing those boundaries, especially coming into that helping relationship, beginning that so that we know what those are and what those look like. So even as far as starting with consent for confidentiality, explaining to them right from there what that is. Even when we do the treatment plans, if being Indigenous, there may be ceremony that's involved in that, so talking about those boundaries, talking about those consents, what they're comfortable with, what they're not comfortable with, what I'm comfortable with, and allowing them to know that if they're not comfortable with anything, that they can let me know and that we can discuss that. So I think having that open, honest relationship right from the beginning is very important, in moving forward in that helping relationship. So for me, I say right at the beginning, just having that discussion, starting to talk about it, and as we go forward in that helping relationship, when things come up, having that, being comfortable to say, hey, I'm not, when you said this, I wasn't comfortable. When, I don't feel like being touched right now, because we do, especially with residential school, we work with a lot of our clients that are survivors of residential school or of the generational effects of residential school. And we know that sexual abuse is a huge issue. So, and looking at that and being aware of that, setting those boundaries, but saying, oh no, you can never touch. No, because we're trying to help to say that there are healthy boundaries. Just because I touch you doesn't mean that it's a sexual innuendo. So I think, I'm working on those by getting there. So again, establishing that right from the beginning and then working forward from there. So having those boundaries and consent is very important. Which now.
Yeah, that reminds me of something. When we do practice consultations with people, that oftentimes, we'll say something like, have these conversations early and often.
Yes.
Right? It's not just kind of a one and done situation.
Exactly.
Right? That reminded me of that. Thank you for that.
Yeah, I think what, I was reflecting on when we had this question, right, earlier on is I think things that we need to also consider is that have we had these conversations with ourselves, right, as helpers? Because I think, coming from a cultural lens, I think often, as helpers, we don't necessarily have had that conversations with ourselves because of the fact of perhaps our cultural background, our upbringing. Speaking as a Chinese woman, I think for me, I often think about role modeling. We don't necessarily see that growing up, right? Or in terms of boundaries and consent. So, for us now as helpers, as practitioners, even before we have that conversation with our clients, we need to start having those conversations with ourselves, right? And maybe in the opposite way around, what are my boundaries? What am I consenting to when I enter this therapeutic relationship with a client? I often think about that because it's like, am I trying to people please? Do I want to be that savior or that helper? But then we also have to take a step back and recognize boundaries are actually really helpful in this process, because just because we have boundaries doesn't mean that we can't help, right? And sometimes we have to be really firm around, what can we offer, and maybe we can't offer certain things. Then that's when we know that maybe we need to take a step back and ensure that we communicate that with our clients. So that's sort of what I have been thinking about.
That's great. I mean, self-reflection, right? I mean, it's baked into our training.
Yes.
It's in the standards of practice. Like it's such an integral part of being a helping professional, right?
Yeah, absolutely.
Thank you for that. Alistair, question for you. What's the most important thing you look for from your perspective when speaking with a new health practitioner?
When speaking with a new clinician, I mean, I'm going to echo some of the things that have already been said, but I think particularly for me, I would like my practitioner to tell me that I can say no to them. And I would like them to do that early and often, as you said, right? Like that particularly because boundaries are difficult, particularly for when you're asking somebody for help, it's difficult to then say no to that person. Particularly when, in some cases people have needed their practitioner to sign off on something, or they need their permission to access medical care, or to access their kids, or to access benefits. It can be very difficult then to say no to that person, even if that's not something that is applicable in your current practice relationship. Even if you don't do any of those things in your practice. So just to echo again, baked in from the very beginning, I would like them to say, you can say no. Right? You can say, this is making me uncomfortable. In fact, if something is making you uncomfortable, I want you to say, this is making me uncomfortable. And we can talk about why and how to fix that. I think is the long and the short of it, early and often, as you said.
I love that, right? I think that's super important. I can hear all of us going, right? Is that, yeah, I think that really resonates with all of us, right? I think we've probably all heard stories of people saying, I was seeing a healthcare provider and something happened that really didn't make me feel good, and I felt like I couldn't say something, right? Or even people saying, I really just don't get on with this therapist or counselor that I'm saying. It's like, well, it's a relationship like any other one. If it's not working, you can either say so, or you can find somebody else who does work better for you, right? So I think that's really important to kind of ground our conversation in that today. Thank you for that. The next question I wanted to have a think about is really just the big question of how do you begin these conversations about setting boundaries with clients? And I know, Melanie, you had already kind of started some of this as well, but I didn't know if there's more that you wanted to add to that. And then I'll go to I Ching and then Constantine after that as well.
So like I said, right in the beginning, I like to put that right out there right away, that what the relationship looked like. And again, allowing them to say, if you're uncomfortable with something that I've said, something I've done, let me know. And same with me, I want to be able to tell you things and have that direct, honest relationship with each other. This is what our helping relationship needs to be, open and honest, in order for us to gain any grounds. So I think, having that right in the beginning, establishing that right in the beginning, having those open conversations, and if that's already set in the beginning, as you're moving forward into different issues, I feel that they're going to be comfortable enough to say no, I didn't like that, or anything that comes up. And I think, having those boundaries in place as you're talking about those difficult issues, they're going to feel more comfortable to be able to tell you about it without you getting the wrong idea. And same way with you as that helping professional, being able to bring up these different things, those more difficult issues to talk about in a comfortable way, knowing that it's not going to be taken into a sexual context when that's not what you intended at all, because especially, when somebody is a sexual abuse survivor, or, there can be different interpretations. So setting that, and even being able to say that in your, that, your interpretation may be different than what I intend, or vice versa. If you ever feel uncomfortable, tell me, so that we can discuss that. So being open and honest, I think, that has to be established right away, to have that comfortableness to be able to say in future, if needed.
Yeah. Huge. I mean, I again, just sort of bouncing off of what you're saying, Melanie, I think also what can be helpful that I often kind of consider again in my practice is the idea of sharing what my role is, right? And what I can or cannot do.
Yeah.
Right. And I often do that to help to let not only just the client know, but to also let me know that, if certain things do come up, recognize we can absolutely talk about it. And yet at the same time, my goal is to help you be able to seek appropriate service and support. Right. And so I think building that expectation right from the get-go and understanding, this is what, boundaries are around, my service and how I can help support you can go a long way. And I think at the same time, though, having this conversation ongoing, again, like my co-panelists had mentioned, is really helpful in a way to also, again, check in with ourselves as helpers, because often I think how we navigate some of those check-ins is that there is a power differential. Yeah. So it really should be on us as the helpers to really connect and can see that, okay, this is not something that our client is comfortable with, and then checking in, like, did I go too far, in terms of like, taking that layer off a little bit. So I often have to think about, my responsibility in this therapeutic relationship really lies on me. And that it really should be me to kind of check in and have those ongoing conversations of, was that okay? Like, did I speak, too directly? But then also preface it with knowing, like, this is what we talked about in the beginning, right? The expectation of, I'm here to help support you, and sometimes I'm going to have to challenge you. And if that doesn't feel comfortable for you, then okay, let's talk about it too. Yeah. So yeah.
Yeah, that's an important, really important differentiation. I love the fact that you brought up the power differential piece.
Yes. Yeah.
It's so important to recognize that. And, we do certainly talk in the standards of practice that we need to identify what the limitations and expectations of service are. Right. And there's a few reasons for that. Like, one is to get informed consent from a client, right? That maybe they're coming to you for something you can't provide.
Absolutely.
Right. So you need to make sure that you're both on the same page about what can be offered in service and what can't. Right. But, to your point as well, to set those boundaries that this is what we can do here and this is what we can't do here. And I think that speaks as well, like, even to level of competence. Like, there's sometimes that clients come to us as things that we can't know everything.
No way.
Right. We can't know everything. And so really understanding, like, these are the areas where we can work and I can help support. And maybe there's other areas where maybe we need to bring other people in for this. Right. Yeah. Thank you for that.
If I could just add to that, sorry, before I can get to Constantine. That adds an extra layer of protection for the client in a way too, because in terms of their emotional health, right? Because then they know before they have transgressed, which is both like proactive and protective, right? If that makes sense.
Yeah. Yeah, it's a way of almost protecting feelings in some ways, right?
Yeah, I mean, so that somebody doesn't then feel embarrassed and that damages the helping relationship, or they never come back because they're mortified that they made a mistake.
Yeah. Yeah, no, that's such a good point. Thank you for that. Constantine.
Yeah, again, because we're reflective practitioners.
We should be.
We listen to each other, and yeah, I was just a couple of things. So, therapeutic alliance, safety between the practitioner and the service users. Where is that discussed? So, in my world, working in an institution, there are certain standards set forth by the institution, and also we're guided by the college, baked in, as we said. So we run groups. I'm in addiction services. So there's an inherent understanding that when you're in group, there are certain norms, group norms to follow. And then we co-create and add as needed based on the group that comes our way. Because I come from a community with many subcultures, with their own language, and often frank discussions on sexuality and addiction. So that has to be taken into account, as I said earlier, when it comes to creating a safe environment for folks. And again, collaborating, ensuring people's safety, that the language that we use is compassionate and inclusive, as we said earlier. So that is set forth right at the start. And then in the first meeting, we make sure and check in with everybody that these norms are going to be adhered to, and then adjusted along the way. And then, as Alistair had said, if there are any perceived transgressions, then the clinicians are there to ensure that the cohesion is there because they're in treatment, right? So, but in private practice, again, as I said earlier, based on the service user and the clinician's comfortableness, is that a word?
It is.
Right? When you develop this therapeutic alliance or relationship with the client, and again, it's in a closed space, as Alistair had said, this is where you ask about when to say no. This is when I'm going to say no, and then the clinician will support that. And I think when communication breaks down is when we're not understanding each other, right? So again, it's different for every practitioner, but I mean, if we make it a practice to get this upfront, as Melanie had said, and Yicheng, all right, and being reflective about it, I think having that flexibility of communication right at the start, and then the alliance can continue and strengthen.
I love that.
I think.
That's great. Thank you. Alistair, do you initiate conversations about setting boundaries with health practitioners, or is that the responsibility of the health practitioner to initiate?
I'm going to say something really blunt about this. And
Yeah.
quite honestly, if I have to initiate a discussion about boundaries with a practitioner, that practitioner has failed badly. And frankly, eroded any trust that we've built so far and any therapeutic alliance that we've built so far. Like, in my opinion, that takes you not just back to zero, but into the negatives. Because if I have to tell a practitioner, and again, not in the context of we've talked about boundaries, this is how we address them. So not in the context of after that saying, hey, that made me feel uncomfortable. But if that conversation hasn't been initiated by the practitioner yet, and a perceived transgression has happened, and I have to be the one to bring it up, that's going to make me not want to ever come back, or send my aging parents there, or leave my dad with dementia in their care because they've told me that they're not safe.
Yeah, and there's explicit ways to tell you that, and there's not implicit ways to tell you that, right?
Absolutely, yeah.
Yeah. Oh, I appreciate that. Thank you.
I'm sorry if that sounded really harsh. It's just...
No, that's a good point.
And I think we probably all agree with you, right? That, I mean, that certainly is the role of the healthcare provider, to do that, and the therapist to do that. That, as I Ching already correctly said, that there is an inherent power imbalance in these relationships, right? That, and I will often say this during, my private practice consults and presentations, that, the nature of the work that social workers and social service workers do, people are coming to us during times of transition, during times of change, during times of crisis, during, it's not when everything is going great in their world and they want to say, hey, everything's good. They're coming because they need something from you. And that's an inherent power imbalance, right? And so I totally hear what you say and take the point and agree with you that it is incumbent upon and the responsibility of the professional to be clearly outlining those boundaries from the start and early and often, right? Thank you for that. And bluntness is welcome. So I'm curious now, and Yi-Ching, so that I'm going to start with you as well. If you can think of examples when touching a client in the I'm going to say that again. Can you think of examples when touching a client may occur in the therapeutic setting? And could you provide examples of maybe when this could be appropriate and maybe when it could be inappropriate? And I'll start with you, then Constantine and Melia.
Again, I think we go back to what you were just saying, Christina, is that, people are coming to us during a time of need, of crisis, right? And so, a lot of times our clients are coming and speaking to us about really challenging things, right? And so I think there's an inherent need for all of us as humans, regardless of race, culture and background, is that that sometimes physical touch is going to be present, right? In some of these therapeutic relationships. But I often think about, my time working in the schools.
Yeah.
And working with little kids, right? And that, understandably, our school system has sort of, adopted this no-touch policy when it comes to children. And for various reasons, of course. And yet I think, when we're working with some of these really young kiddos, right, that sometimes they do really need that physical connection, right, that, we may be able to provide for them, of course, with consent, right, and within boundaries to do so, right? And so, I often think about us having to just acknowledge, like, are we comfortable doing that, right, for our client, right? And so, and being very honest and transparent, when I first started as a social worker, I wasn't a parent. So I wasn't very, like, I'm working with kids and then, well, let's go through the CBT triangle, like, right? And so, but now being a mother, working with kids, it's this need of acknowledging, like, yeah, they need that. They need that physical touch sometimes. And sometimes checking in and being able to say, like, is it okay if I, give you a hug, right? Like, and during those times, right? I think in those sort of situations and contexts, I think, again, going back to Constantine, like, environment is really, really important for us to differentiate. Working with, young kiddos in schools might be different than working in inpatient hospital, right? So I think there are settings where, physical touch can be appropriate and can actually be very helpful in the helping relationship. But I think to kind of finish off with what you had also asked about inappropriate touch, right? I think this is where I think when boundaries are not communicated very clearly right from the beginning, regardless if we think about context or environment, if we didn't intend to harm, the impact could still be there. Yeah. So knowing your client is really, really important. So I wouldn't necessarily engage in maybe physical touch, especially when I've been working with a child that has severe trauma, that, came from, a country that had just gone through genocide and war, that may not necessarily be what they need, right? But, with a child that might be that had a different maybe background, then yeah, that could be a little bit more appropriate. So I think, again, it really comes back to knowing our clients, acknowledging that boundaries have to be, communicated right from the beginning and continued on. And then also acknowledging that, that there's going to be times where it can be appropriate, but times where we as the helpers should know it's not appropriate.
It's interesting when I'm hearing you talk that you said several times, like, knowing your client is a big one. So it seems to me that it's like these are things that can't even be explored until you know your client.
Mm-hmm.
That's right.
Yeah.
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 That's right.
Yeah.
Yeah.
Interesting.
Mm-hmm.
Yeah.
Just when you said that, there are times in crisis, especially when you're responding to a crisis, where people are in hysterics, people are sobbing, people are, and you can't just stand there and be stone-faced, but a touch. Can I touch you? And then sometimes they're coming at you and they're hugging you or just falling, especially when there's a death or something, like there's a fire going on, and so these are real. You can't just be this stone figure either and I don't know you. No. So by you pushing them away like that too can cause a lot more harm than good. So being aware of that, knowing what your comfort zone is too, again, being aware of your environment, so I think being prepared, especially if you're in that where you are going to be responding to crisis, where you are going to be responding to in the moment emotions, and feelings, being prepared for that, but again, gradual, and maybe they do need that hug right there and you don't even know them, so being prepared for that, but being very appropriate and where, how, how you're initiating that touch and where you're initiating that touch, So I just had to put that in and being it was right there.
Yeah. No, not at all. I mean, that's great.
It's true.
And I think what you're saying, Melanie, is like context is really key, right? And that, if you're attending to a crisis, that you don't know what
how is going to,
how it's going to be, right? But what I did notice you do as well, and each of you are demonstrator right now. I'm sorry, but you were like, "Can I touch you?" You said, "Can I touch you?" or "Can I hug you?" Like you still went for consent beforehand, right? And I think that's an important observation.
Yeah.
Right. Yeah. Thank you. I mean, you're already, answer your question if you want to right now. Like, how do you navigate? Or that wasn't the question. It was examples of when touching a client could occur in the therapeutic setting, right? So crisis would be one.
Crisis is a huge one, especially where we work. Working with kids, they're very, touchy, and so being aware of that when you are working with children, and especially when you're getting into those issues of bullying and, especially if there's a death, the grief and all that, they are going to, cry, they are going to sob, you're not going to just sit there and let them, they need that comforting, they need that touch, for a lot of our people going to residential school, they didn't have that compassion. When they fell and got hurt, there was nobody to say, "Oh, are you okay? You're going to be okay. Let me look at your boo-boo." Or when they had bad nightmares, to say, "You know what, you're safe. Boogeyman's not coming." When in reality, the boogeyman was coming at night. Yeah. So these are the things that, we try to teach, that it is safe, that touch is okay, so, but getting to that, working up to that, especially with survivors that have been through that, relearning that touch is can be helpful, can be comforting, and for our youth to know that, that it is comforting, it can be in a healing touch, almost like. So, I think, again, knowing, if you do get to know your clients, but in those moments where you don't and someone's having, again, not being that stone person, no, I can't touch you, be compassionate. No, you'll feel it, even as far as adults, there's going to be adults, that are in that same crying in that same, they just need someone to feel that they matter, that someone cares for them, and so putting that hand in again, is it okay? Always asking, is it okay if I touch you? Or, or even asking for that consent, do you need a hug right now? Is it okay? So I think, we don't have to be that stone cold residential school kind of, persona. We come into this field to try and help, to try and be that comforting, when needed too. So being aware of your environment, being aware of where your the person is at, so yeah, there are going to be times. Be prepared for it and how you're going to go about it. You don't always have to. I'm not the one for like the handoff, like no, especially if I see a child cry, I'm not going to be just sit there and watch them cry. I'm sorry, I just can't, so.
You made me think about so many different things, Melanie, that like one of them, I mean, I've also seen and been experienced when you like, do you need a hug right now? It's like, no. And you're like, oh, okay.
That's
right.
And say, that's okay.
Absolutely. Right.
And I always say that to yeah, that's okay.
I think that's so important.
Yeah.
And it sounds to me that some of the work that you're doing, that probably talking about how to incorporate appropriate touch, is probably going to be some of the conversations you're having with people early and often.
Yes.
Right? That, especially when people do have a trauma history, that can have such negative associations for them, any type of touch. But maybe that's part of the goals, right? Is to understand how touch can be.
Yeah.
Right? And it's interesting. We've had these conversations a lot as well, that I think where you have those conversations, again, like we said, early and often, we have them clear, they know the limitations, expectations of service. But these are also things then that, they get documented. And, you're talking to your manager or your colleagues about, you're certainly not asking clients to keep secrets, right? I mean, these are some of the red flag things I think that we can see sometimes people do, or like doing it outside of the working context as well, right? So I think that's, you've really stimulated a lot of things for me to think about. Yeah, so thank you for that. Thank you. Yeah, Constantine.
Yeah. Again, the panel has a lot of experience in various fields, and so, or at least in practice settings. And I'd like to speak to about the touch, and also, again, context is very important when you're working with marginalized, sexualized communities. Again, I'm going to state language is very important, that we're on the same page. For some practice settings that you need to get into the community and have street cred, and again, that is reflected in your mannerism, your language, the way you dress. That's to invite participation from the service user so that trust is built in. So whether you're using regular language, but up front you're going to say, I'm a social worker from so-and-so agency, and this is the service that I'm providing. But the language will be different so that you can connect with the service user. Where we, and Christina is alluding to it, I think, is the gray part. And that's hard to manage sometimes when you're under stress. And I Ching was talking about, are you comfortable with this, right? And am I a hugger? Mm-hmm. And those are the truths that we reflect on a lot. And what's in the best interest of the client at this time? What are their needs, right? And all of this happening while you're on the front line. So from my perspective, again, because of our training as social workers and the Code of Ethics, which I read and remind, and it's like, okay, they're good because it talks about boundaries and it talks about like consent. And that's your framework for your practice. And then you're in the front line with no help, oftentimes. And you got to rely on your own code of values, right? And then I always think about what's in the best interest of this client. So, for example, if they're under stress, if, hey, can I give you a fist bump? May I touch you? Can I do this? Okay, because it's just to ground them, right? If the hugging is the thing that needs grounding, then what's the language for grounding? And there are many ways. I saw this thing with school children where they get to choose, right?
Yeah.
So I thought that was brilliant.
Finish that thought, because that was a shorthand. They get to choose what?
Oh, so you get to choose whether a fist bump, a pat, or a full hug. Or just even like a hi. Sorry, hi.
Just
hi.
Hey. Yeah.
How is that? How do I express it?
That's that TikTok thing I see a teacher does with the students after every, and there's they get to point, and then she gives them whether it's a hug, a high five.
Before they enter the classroom, they get to choose which method of comfort to receive. And again, that is developed over time with consultation with the participants, right? But again, getting back to touching, it's again in a highly sexualized environment. If you're working with maybe sex workers, and their expression for communication is touch, I mean, then you need to go for supervision and just discuss how you're going to manage that. And I think that is the most important thing, is that you need supervision when you're on your own and you're relying on your own code of ethics plus your training. And so to put the practitioner or the clinician or the service user in a situation where they're on their own, and that's maybe where the gray is, especially for people in private practice, and they don't have regular supervision to kind of process these things. So I didn't need to.
No. Sorry. No, I think that's great. And that is something that we certainly talk about, as well as that private practice, the name suggests it's private, right? That, you're not on a team, right? Like you don't have the whole support of your colleagues, a manager that you can just like go in down the hall to talk to, or community work too. You're often by yourselves. And this is why, and I love your point, Constantine, that it's like, yeah, you need supervision. You need to talk to people about this, right? Like you need to work this through. And that is also, one of the things that, again, we can document, that we can say that this is part of the treatment plan. This is how we're navigating this issue, right? Alistair, curious if you can maybe speak to the client perspective around the issue of touching.
Yeah, I mean, my co-panelists have brought up so many aspects of what I would have touched on this. It's really wonderful to hear, actually, from the other side as well. I think that it's really important to be conscious of your language, right? As you were talking about, with context, with who your client is, but also in terms of the actual language that you use, because again, just recognizing the power differential and the difficulty of making somebody say no to you. So centering their need rather than like, can I give you a hug, right? If you say no, you're saying no to me giving you a hug, right? Whereas if I say to you, like, would a hug be helpful right now?
Yeah.
Right? That centers the, clearly the decision is about the hug, right? And the decision is about the hug and is it helpful for you, the client or participant, rather than making it about the dynamic between you, if that makes sense.
Yeah.
Again, not that you're always going to, find exactly the right words, but that if you have the time and space to think about it, that centering like the client need is really important. And like Yi-Ching was talking about too, like the self-reflection about like, does this person need a hug or do I just want to give them a hug? Because I think it'll make everybody feel better. So that, and that was the part about, but also recognizing that like as a practitioner, you're also a human, right? Like you said, you can't be just sort of the stone-faced like clinician, right? And that it is important for the therapeutic alliance to be connected and for people to trust you, and so that, but at the same time, you are both two humans together, but as a clinician, or as a practitioner, your needs aren't the ones that need to be centered.
No, absolutely not.
Which is sort of it's a bit of a boundary to walk, if that makes sense. Yeah.
It's such a good point. I mean, sort of like the primary mandate of the professional relationship is to keep the client's best interest paramount, right? Period. Dot. I mean, that's the starting, the beginning, and everything in between of the professional relationship, right? I really love how you said that it's not, can I give you a hug? Because then maybe you don't want a hug, right? And, sometimes I don't want a hug, right? Like, it's not, I'm rejecting you, right? It's just, that's not what I need right now, right? So, like, would a hug be helpful?
Which also helps, like, if you're dealing with somebody who has a history of being like a people pleaser or of abuse, or it's not safe to say no, that's also modeling consent in a really healthy way, right? Because it makes, them go, do I actually want a hug?
Mm-hmm.
Can I take a second to think about that?
Yeah.
As opposed to just like, yes, I'm going to say yes because somebody's offering something to me and I can't say no to it.
Yeah. No, I think that's so on point. I really, really like that. Thank you very much. Thank you. I'm curious, is like we've started kind of talking about this as well. And I just wanted to kind of bring back, as I mentioned kind of in the introduction, that when we're talking to the Citizens Advisory Group, and I know, or Alistair, you're very familiar with them as well, and they're really great. They're this panel of essentially professional patients who provide regulators with feedback on when they're trying to put new initiatives in place, and that we were introducing to them that we talk about in the standards of practice. And I just need to look at my notes for 1 second. That we talk about the fact that you can't have touching or remarks or behavior of a sexual nature that aren't appropriate to the helping relationship. And their question to us was, well, how do you know it's appropriate to the helping relationship, right? And I was like, wow, that is really interesting. And, I'm listening to our conversation today as well, because I think a lot of times that, of course, it's about developing that relationship so that we understand people. But some of the things I've wondered about, too, is that when we start to have those conversations really early on about boundaries, about consent, are these things that we're initiating at that point in time? Like, are we talking about, okay, and so, just so you know that I have mandatory reporting obligations for X, Y, and Z and blah, blah, blah. As we progress into our professional relationship, these other topics may come up, and I'm curious, and I'm wondering if those are ever thought processes that come up, or how those conversations happen. And so I'm just kind of curious from the panel to know how to navigate those conversations about touching clients, such as hugging in a therapeutic setting. And would that be the same as like navigating, making remarks about a sexual nature? And I know, Constantine, that you talked about some of the work that you do, like remarks of a sexual nature are kind of part of the parcel, right? And that you almost have to kind of embody some of those comments just so that, your clients can relate to you, right? So I'm curious, if you could talk to me about how to navigate those conversations about touch, hugging, or behavior remarks of a sexual nature.
Yeah, so I'm going to reference a job that I had where I had to enter a very highly sexualized, charged environment, and it was HIV prevention. So it was called Towel Talk, and it was a pilot project that embedded us clinicians in a highly sexualized environment to provide education, but also on the spot counseling. And so we did a lot of research and background into, consent, and we had a supervisor to help us along. And how we navigated that was through advertising. So basically, counselors are going to come in from, for 1 hour or 2 hours, and they'll be in this room, and they're highly identified, and they're wearing T-shirts, and so they knew that we were off limits, right? But in that environment, clothing is not sometimes available. Mm-hmm. So how we navigate that is if they come into the room, we're clearly dressed, so we're modeling but also we're not wearing suit and tie. So that's how you kind of manage the street cred, but also your professional stance, right? And again, there's distance between us. There's a desk. So there's a clear boundary, right, to ensure that the client is there and I'm here. And the language is back and forth. And sometimes in a highly sexualized environment, they may forget that you're a clinician, but you just remind them, right? And if there's a boundary crossing, then we have the right to remove that person from the space, because it's no longer a counseling session. It's becoming this uncomfortable space for us. And now my safety is compromised. So it's speaking to us being alone in an environment. So as a clinician or as a practitioner, you set the boundary, as Melanie had said, right there and then. And as far as touching is concerned, right, again, they may reach over, then you just politely decline, right, with a smile. But I mean, again, it all depends, because you'll get to see the client's presentation, and your skills will come into play in your assessment of the situation, right? It's brief therapy, and again, if you're uncomfortable with your practice setting, right, then maybe you shouldn't be there, right? You know your comfort level, and again, some things may come up for you. That's why it's important to have supervision to process these uncomfortable feelings, right? And again, getting back to private practice. So yeah, whatever happens there, and a client may misinterpret a handshake as an invitation for more deeper relation. And again, if we say it outright and say, I shake your hand sometimes, is that okay? Right? And so, but again, that's in the conversation. So, I forgot if I was answering your question.
No, it sounded good to me. So that things like navigating those conversations about touch and right?
Yes. Just quickly, I did have a client that asked for a hug. And again, because of my relationship with this client, I know this client respects my boundaries, and I also understand why this client is asking for a hug. And again, folks, it's like, you do this. You don't do the,
Yeah.
So that is the implicit and explicit understanding about boundaries. I mean, I'm providing you the grounding that you need, but not that long enough that you'll think that there's something going on.
Yeah.
Especially with in the practice setting that I'm in, which is the 2S LGBTQ plus community, that sometimes we see each other. It's a small community, but a big community, and then we see each other in other settings. So that's why boundaries are very explicit in those outside of your practice setting. Yeah.
Thank you.
Thank you.
Jane, why don't you go to you next? I feel like you've had some more to say.
Oh, no, I was just, again, thinking about, again, like our comfortableness of having those conversations, right? And, although right now I'm working mostly with young adults and adults generally, I kind of go back to just the experience with working with children and youth, right? And that sometimes, when we have a child coming up to us and running up to us and giving us a hug, even like Constantine says, it's like this sense of like, versus that hug that maybe I would give my own child, right? And so, I think developmentally appropriate conversations is really, really helpful. And not just even with kids, right? Like, I think we have to think about adults as well in terms of, we talked about language, even adults with exceptionalities, perhaps. Like, again, having this understanding of, in the moment, because sometimes we don't necessarily have those conversations right in the get-go, right? As we're talking about this, I was like, I don't necessarily talk about that, like, for my first appointment, like first intake, where we talk about, sometimes we might, as we continue on our counseling sessions, like, we might like there could be opportunities where, you know, I might want to like give you like a pat on the shoulder. Like, again, that's something that I haven't really thought too much about. It's always in the moment.
Yeah.
Right. And so I think it's just about acknowledging that sometimes we just have to be open and honest about how we feel, and also thinking about, you know, again, is this the best interest of my client? You know, like, how would it feel if I rejected this child running to me when they saw me, you know, in the hallway because they haven't seen me in about a month, right? And how damaging that could be, right? Not to just our therapeutic relationship, but to that child who, again, knowing your client, right, has a sense of, you know, being abandoned and rejected, and didn't have those, you know, opportunities to form a really strong and safe attachment with a caregiver. So again, I think using that, you know, gentle approach, but also validating that, you know, that they're comfortable enough to do that, right? You know, but then gently direct them to say, like, you know, perhaps the next time when you see me, you know, is it okay if we just, you know, do a fist pump, right? Instead of you running down the hall and like giving me a bear hug, right? And acknowledging like that could absolutely also be a really helpful role modeling for that child too, right? So that they understand, you know, what can be appropriate touch, you know, as I continue to grow. And not necessarily seeing every adult that gave me some sort of attention that I'm just going to go for it, you know, and seeking that affection from them. So, you know, I think that would be one thing that I was thinking about in terms of navigating in a therapeutic setting, but just about conversations and remarks of the sexual nature. Again, you know, if we're having that conversation, and now I'm thinking more about, you know, working with adults and young adults, if we're having that conversation, then maybe there is already a breakdown. Again, context, right, Constantine? Like, we're already having maybe a breakdown in this therapeutic relationship. You know, if I'm having to mention something of that nature in regards to, again, validating maybe you're feeling safe enough and vulnerable enough to share that, you know, comment or insight with me, and, you know, I'm not comfortable with that comment, and I think we need to maybe further talk about this, and, you know, maybe really look at what are the options. Do we then end service?
Yeah.
Right. But again, that goes back to sort of our own internal reflections too, culturally speaking, and people pleasing and wanting not to have conflict and wanting to be that helper. But then now understanding, like, you know, that's not going to be helpful for them, nor is it going to be helpful for me. Right. So.
Yeah, thank you. I appreciate that. And it's funny, you know, you mentioned they're like, I haven't always thought about having those conversations right at the beginning. But it was through this process and like this feedback that we got from clients that I was like, yeah, I don't know. Like, I was never taught to do that either. Right. So it's interesting. It's a thought to consider. Yes. Kind of what spawned us being here today. Melanie, thoughts on, you know, having conversations about touching, hugging, or even comments or remarks of a sexual nature? Like, how do we navigate those conversations with clients?
Well, right in my initial meet with them, after doing all the paperwork, consents and stuff, I do the initial assessment with them, getting to know them a little bit more and what issues they're going through. Especially working with First Nations people, we know that it's always not just one issue, it's a layers, you know, especially with trauma. So within my assessment, there's multiple questions, and I kind of leave them open-ended so that discussion can happen with some of the things. And that's one of the questions I do ask, yes, no, you know, and if they want to elaborate, they can, is, have you been sexually abused, you know? So that is one of the questions, but there's other questions in my assessment as well to try and help to open that up. So I put it out there right away, right? That first visit, and then, you know, we can elaborate on it. You know, and even with me knowing who I am, even when I'm laughing, I'm ha ha ha, ha, you know, with my friends and family, even so I let them know, like, sometimes, you know, when I can be touchy, but, you know, I am very professional. And if you're uncomfortable with anything, even my laugh, because I am so loud when I laugh, I said, let me know, so, and we're laughing most times and we're even talking about that, right? So, again, putting it out there, having these discussions. And I really appreciate with what you said is it's how you say these things and setting your boundaries, even if someone's coming at you, with a smile, and just because they, may have tried to, initiate something and you said no, doesn't mean, boom, you strike, you're out and you're good. What are you doing? And, you don't have to react like that either, so and just setting those boundaries. Or even if they do make a comment saying, like, where's this coming from? Like, why would you say that to me? And again, this could be you can turn it into a therapeutic. Maybe it's related to the sexual abuse. Maybe it's related to previous sexual relations and so changing it to where, looking at healthy relationships, so these teachable moments can be there. So again, you don't have to cross them out. You're gone. You don't need to end this helping relationship, but it's not helping me. Are you? So again, I really appreciated what you said and, being aware of that, but still having your own boundaries too. But again, if things do happen, be very conscious of it. In the private practice, yeah, you are by yourself. I'm very fortunate though that I do have a group of Indigenous, First Nation social workers, where I can kind of, confidently,
Yeah.
debrief with and I like my colleagues that I share my office space with, so I'm really, fortunate for that. But for ones that don't, try and find that colleague where you can, have that debriefing with. It's really important, especially as a helping person.
Such a good point. Yeah, supervision, consultation with your peers, like community, right? And it does, I think, bear reflecting on the fact too that I know we talked about that we've had these like number of complaints that the college has received about sexual abuse. The majority of them are in a psychotherapeutic setting. Right. And again, like you can kind of see that because you are isolated, like, and there is that intimacy to the relationship. So I really hear what you're saying, that it's like bring in your people, bring in supervision, get consultation. It's so important.
Just to add on, when Constantine was talking, like those misinterpretations, like a lot of times it's not even, it's the client or the ones you're working with, but especially being in the different worlds, you see people in your work setting, but then you see them outside of the work setting. And, especially in our small communities too, it's the same way, for us when we go into community. We know people in our communities, we see them outside the community, we see them within our working space, so a lot of times when you're working with individuals and then their spouses may get insecure about that, so and then they're misinterpreting or trying to start something. So there's a lot of dysfunction that can happen on the sidelines too, that can contribute to a lot of this too. So being aware of that, and again, setting those boundaries, making sure you're documenting everything, and and again, talking with your colleagues. So
It's so true. I mean, registrants work in small communities, right? You're going to have dual relationships, but it's so key to kind of explore during the professional relationship how we're going to navigate that out there, right? Like setting those expectations, right? Thank you. Alistair, wanted to turn to you as well, kind of your thoughts about the conversation that's happening and just, what has worked well for you when discussing intimate topics with health and therapeutic practitioners?
So I just wanted to highlight a couple of things from my co-panelist said, which was first that, like, we talked about it at the beginning, right, and talking about the consent, but from a client perspective, also at the beginning, you're getting a lot of information, and meeting a new practitioner can feel super overwhelming and like anxiety provoking, right? Like, I have to be really vulnerable with this person. What are they like? Are we going to be able to get along, right? Am I going to feel safe? So that's why I think the early is super important, like we've talked about, but also let's not forget the often, right? Because it can be forgotten, right? And also you don't necessarily know how that's going to apply until it plays out. Like you might know, as a practitioner might know, but as a client, you might not know all of the ways that consent can be modeled and accessed, right? Until you start to get like real examples of it through your therapeutic alliance and relationship. And I just wanted to highlight also everybody hit it, but that there's also a way that in refusing something inappropriate, you're modeling appropriate refusal.
Yeah.
Right. So you're not only allowing them to have a helping moment in terms of being treated with grace when they've, transgressed or perceived transgressed, but also that you're showing them a different way to do it.
Yeah.
And how to handle that situation on their own. Like that kid who was, hey, maybe next time we could fist bump instead of a big hug. Maybe somebody's hugging them and they don't really want to be hugged too, right? So you've shown them that they could say, hey, maybe next time we meet, we could fist bump instead of hug, right? To whoever is making them uncomfortable in their life. In terms of turning back to my specific question, sorry about that.
No, don't, please.
In terms of talking about like intimate topics, as a trans person, I've had to talk about all sorts of very intimate aspects of myself and my life with medical practitioners and practitioners, not all of whom I necessarily wanted to share that information with all the time. So I think it's really important if you are having a discussion about something that's really intimate for somebody to highlight, first of all, give a heads up that it's coming so it's not out of the blue, right? Like, hey, I want to bring up a sensitive topic. So they don't just get blasted with whatever it is that you're saying. And secondly, why is it important, right? Why is it important that we're talking about this? Like, is this you as a practitioner just being curious about a trans person's, what's in their pants, right? Right. Or, you're talking to a partner of a trans person and, oh, well, what surgeries have they had? Like, is that important? Is this the part of the conversation where we talk about our partner's genitals? Like, and so I think that's really important, is knowing why it's important to the therapeutic relationship, and what the context is that you're discussing the sexualized behavior. Again, just to echo what you were saying. Yeah, that's what I see with that.
Profound. Thank you very much. Yeah, and like really vulnerable. And thank you for that. I really appreciate it. Thank you.
I have to credit my wife with that one. Is this when we talk about our partner's genitals? Is her response when she gets inappropriate questions about me?
Good for her.
Yeah, she stops.
That's a statement. That's a statement. I've got my eye on the time, and I do want to have one more question for everybody, and just kind of skip into the end to kind of figure out if there's any final strategies that you haven't mentioned that registrants can use when discussing issues of consent and boundaries. And Alistair, I'd like to start with you. I don't know if there's more that you'd like to say, but I wanted to make sure that the client voice kind of gets highlighted here. So I was curious if you've got any other kind of final strategies that you haven't had the opportunity to bring to the floor yet, to say, hey, social workers and social service workers, when you're working with clients, these are some real things that you should maybe think about when you're talking about consent and boundaries.
I mean, just all of the things that my co-panelists have highlighted so far, right? Early and especially often modeling the behavior and making it explicit. Right. And also not letting a vibe go. Right. Like if something feels uncomfortable, like, hey, I'm feeling a vibe. Can we talk about what's going on? Did I say something that made you uncomfortable? And not letting that go away, because that, I think, are sometimes in situations where people go away and think about it and go, I really didn't like that. And I think that person was doing something inappropriate. When if it could have been addressed earlier, sort of avoids that whole process. And is really safer for everybody involved.
Yeah, don't let a vibe go. I like that. That's really cool. Thank you. Thank you. And Yicheng, Melanie, Constantine.
Yeah, I think maybe just to kind of circle back and bring it back to what I initially had mentioned in the first question. I think, as social workers, social service workers, we've entered the field for a reason.
Yeah.
Right. And I think each and every one of us, may have had our lived experience. Some of us have experienced trauma, and we have our own ACEs, right? And I think sometimes we have to really be clear about, where we're at, right? Because when we're not well, we can definitely do harm. Right. And so I think, of course, consulting with the college and with our managers and our peer supervision is really, really helpful. And yet I think at the same time, we also have to acknowledge, we have our own stuff that we carry into every session that we have. And that sometimes, we need to be really clear with ourselves around, what are these boundaries that we have for ourselves? Because like I said, if we're not well, then we're not doing our job.
Yeah. Like hurt helpers hurt others. Right.
That's right.
Yeah. And
I'm doing good.
yeah, right. And it makes me think back to like even my social work training, like the reflective journals that we all had to do ad nauseum. And then you realize, oh, this is a practice I'm supposed to take forward always with me, right? Into my practice. Yeah. Thank you. Melanie?
Like I said in the beginning, right from the beginning, you have these conversations right from the beginning. You carry onwards throughout your helping relationship. I think gives that sense that when something does come up, it's okay to bring it up. And again, just keeping it there all the time. Having these check-ins, like you said. But I think if you set those grounding right away, then they know that it's safe to say, when you said that, I didn't like that, and for you to say, where did that come from, when you're feeling uncomfortable, so I think right from the beginning, setting that grounding, setting those boundaries doesn't have to be rigid. I'm not moving out of these because depending on where your client is, where you are, that flexibility to be there, but having those boundaries, getting consent, that needs to be there right from the beginning and moving forward throughout the whole helping relationship. So, yeah.
Thank you.
Good.
Constantine?
Yeah, I think everything has been said. And again, as social workers, social service workers, again, the code of ethics, I think, is a good touch point on to reset. But I think, again, just tying it to the CCT.
Yeah, got it.
Continuous training and supervision is important, and self-reflection and journaling and all of that. But also taking care of the self, right? And just because we use the self in our practice, and that's why we're self-show workers, because we connect. But we also need to disconnect at some point and just take care of ourselves. So we're all human, as everyone had said here, and I appreciate this panel.
That's awesome.
Thank you.
And thank you also for doing some of my job for me, bringing up the code of ethics, these standards of practice, continuing competence program. I promise you that was not planted, but it's very much appreciated. Yes.
I felt like you were my teacher and I had to.
And book feasing.
Maybe some reflection on this, right? Absolutely. This was excellent. I think that there's so much more that we could be said. I know that I'm having a lot of fun, and I'm getting a great feeling from the panel too. I think that there's a lot more that we could be saying here. But I think that there's certainly been a lot of key themes that we can pull away here, right? That we need to be having these full conversations with clients at the outset and often about the expectations and limitations of practice. And then that's going to vary depending on the context of where you're working, the client group that you're serving. Right. So these are things that we need to continue to reflect on, and that, we need to have clear conversations with clients about what they're comfortable with, about information that we need to gather for our process, and that we also need to role model, how to set those good boundaries, right? Because sometimes that's an area where people haven't had the opportunity to grow those skills, right? And something else I've really heard too throughout as well is that just that self-reflection is so pivotal. And consulting with your supervisors, with your managers, with your peers. If you are having any type of, what we often refer to as like countertransference or, emotions, with your clients, like explore that. And it's to your peril if you don't, right? To use Alistair's word, like if there's a vibe, you need to figure that out. So and I think that's really good advice. So I really appreciate all of you coming in and sharing your expertise and your knowledge with us today. I think this was really, really exciting. We're going to move on to the question and answer period right now. So we're going to ask that attendees, and I'm sure they probably have been already, to be submitting their questions through the chat feature, which is on the right-hand side of the session page in the virtual portal. And we're going to do our best to answer as many questions as time permits. But we do thank you for your understanding if we're not able to get to all of our questions today. So Haley, I know that you were behind the scenes.
Yeah.
I can see Haley, our friends watching us can't right now. But Haley, has there been some questions that have come in for the panel?
Yes, there's been a lot of great questions so far, and also just a ton of comments thanking all of the panelists for their insight and for their thoughtful language and words, and just really appreciative of everything that you've said. So thank you so much for that. I will start with a question that we've already received a little bit earlier on. This one is about exercising boundaries within a cultural context. And the registrant says that they absolutely agree that exercising boundaries is important, and sometimes there has to be a hard line. However, they work with Black youth as a Black person themselves, so it's collective and they're open to meeting people where they're at. How would you exercise boundaries from that cultural place without being too rigid and eroding trust in that way?
Go ahead. That'd be like me. Yeah.
I think I spoke to that just in one of the comments, but again, no, knowing your own culture, being aware of someone else's culture, you don't have to be so rigid. Be aware of yourself, be aware of your environment, be aware of who you're working with, and be respectful of that. We all said, you can't just stand there and be so stone cold. And, if somebody needs is sobbing, you ask consent, of course. Do you need a hug? Would a hug be helpful? Getting that consent, but, giving that compassion, showing that compassion, I think is very important. So, yeah, being very respectful of that culture of, maybe hugs isn't, maybe it's a handshake, maybe whatever, is appropriate within that culture. Respect that. That is first and foremost, so be aware of who you're working with, what the culture traditions are for the people, and those need to be respected. You just don't go in and, well, this is how I do it. This is what the college said to do, or this is what,
Or how I don't do it.
Oh yeah, or how I don't do it. If you're working with a group of people, you need to go by their culture and traditions. Be aware of that.
Mm-hmm. I think what I would sort of comment on that is, for all of us, as social workers and social service workers, we've been educated and trained in a very Western colonial approach and mindset, right? And I think when we talk about cultural competency, that's like a real thing, right? And I think, as a racialized practitioner, I think sometimes we have to recognize that sometimes, that's how we engage with our community, right? And recognizing that, right? And that, there's a sense of understanding that there is a lot of gray areas, and that's where we work in, right? A lot of gray areas. I think really what maybe the question could be alluding to, I'm not sure if I'm kind of getting it, is maybe like, what is that hard line, right? And I think this is between you and your client, and recognizing that's how communication is so important. We've already talked about that, right? And really knowing your client and your community, right? So maybe one way I would speak to somebody, maybe another Asian female that I'm working with would be very different than if I'm working with a Caucasian male, a white male, right? So really understanding and just going back to that self-reflection. I feel like I'm like the self-reflection person today. I'm doing a lot of that lately. So yeah, that's sort of my comment to that question. Thank you. Yeah.
And my perspective, again, is context. So again, cultural norms. And if you're working with your own culture, I think there's flexibility there, but you still have to maintain your professional stance and make that apparent off the start because you're providing a service. If it's an individual connection, again, that's between you and your client. But if it's a community that you're going to be participating in their community, then you adapt yourself to their norms because you're providing a service and adapting it so that they understand what the service is all about, and then it makes sense, and then building the trust. I think that's how I kind of see it. Culturally specific services.
Yeah. Thank you. Anything you want to add?
I don't have anything to add to that.
That's great.
Great. Thank you so much. We have a couple questions that have come in about gender differentials when the registrant and the client are of different genders and how to navigate those boundaries where there's no, I guess, misinterpretation of anything. So I won't read out the exact questions, but there are several on that topic. If maybe the panelists could speak to that a little bit.
But yeah. I heard deep in hell. So
I mean, I think again, I think as a woman, but as an Asian woman, I'm very mindful of that. To be honest, I think when I work with adult males, regardless if they're from the same cultural background as me, there's definitely reflection of how this therapeutic relationship and experience is going to play out, right? And I think this is where we have to really be honest, again, with what we're comfortable with, right? And I think sometimes, I think organizational wide versus private practice might be a little bit different. But I think, sometimes we can also say no, right? And it goes back to maybe I can't provide that's the service and support for you, but I know somebody else within my team, or I can refer you to another therapist, a private therapist. Because I think, when there's a vibe, you have to lean into that, right? And it's better for all of us if we kind of know on the onset to say I'm kind of noticing that, this is not necessarily something that's going to be helpful for you, right? And linking it back to what we had discussed earlier on. So, and sometimes we may not necessarily have that choice. But then really being clear around, again, as a woman, I often remember, when I had to meet with parents late in the evening, I would have to have, another staff member be available, right? And sometimes acknowledging that, privacy and confidentiality is important, but I have that door open just a little bit. Right. And so I think, again, just acknowledging that, although we are in the position of being the helper, we can also know that we have our own boundaries and it's okay for us to say no if we're uncomfortable with it, too.
I'm really glad you said that. Yeah. We sometimes get calls from people saying, am I allowed to terminate with someone? I feel really uncomfortable with them. As if, yeah, you are. Right. But, have, where you can hold a termination session, make referrals to other people. But, you're at the end of the day a human, right? First and foremost, right? Yeah. So I appreciate that comment. Yeah. Anybody else?
For me, I'm comfortable with working with either male or female, or, whatever gender they want to identify by. For me, it's about the client and what they're comfortable with. Depending on the issues that they're dealing with, especially if it is around sexual abuse, some, whether male, female, or, whatever gender they identify as, they may be more comfortable talking with maybe a male counselor. And if, I'll put that out there, you seem a little bit uncomfortable, I'm willing to work with you, but if you're not comfortable talking with me, or maybe, you'd be comfortable talking with another practitioner, or maybe even a male practitioner, that's something that I can help you with. We have a list of different, social workers, but putting it out there. Sometimes they'll say, yeah, maybe I need to, or no, it's just something we're going through that. And then we deal with, again, that's helping to bring that out, what that uncomfortableness is, but it's got to be about the client, I feel, when, initially. But if you're feeling uncomfortable about something, then, yeah, like you said, do that self-reflection. What's going on here? What am I uncomfortable with? And is this, but again, having that open relationship, being able to talk to your client about what that is. So, you need to be aware of yourself, what you're willing to talk with the client about, whatever issues it is, especially around sexual abuse. Now, domestic violence, you're going to hear a lot of that. So again, be prepared. What are your limitations? Is this something that you as a social worker, as a helping person is able to do? And if not, maybe, like you said, should you be there?
Yeah.
So, so again, just be aware that always stay client focused, and what their needs are. But again, not pushing you out either, But again, if you're feeling that uncomfortableness, you need to self-reflect what's going on here, too. So,
yeah, just quickly, I'm also comfortable working with all populations, and just because that's who I am. But again, it's client specific when it comes to a weird vibe, and that's your spidey sense. So I appreciate, I forgot that we can terminate. So thank you for the reminder. But yeah, it's again, as to Melanie's point, sometimes they prefer opposite gender or non-binary because it provides them a safety, or because if they work with the same gender, sometimes their perspective is skewed. So they want a different perspective. So I get that a lot in private practice. And when they read your profile, they're looking for a certain value that they connect with rather than your gender. Yeah, that helps.
Like that. Yeah.
I do have something to add on this one. And this is, as a trans person, I've experienced it from both sides. So this is an invitation for any cis men who are practitioners. No matter how much you think you're being an ally, double down. Because I can't express to you the ways in which the world says yes to me now that I am perceived as a cis white man, that it did not say yes to me when I was a gender non-conforming female-bodied person. So to be just extra careful about your language, extra careful about centering your client and their needs, because it's harder to say no to you. And yeah. Double down on your making sure that the person knows that they're safe and that they can expect to be that they can say no. And again, just thinking about other contexts than your practice, because you might think, oh, well, that never comes up in my practice because I'm in private practice or whatever. But if you're not thinking about the person as a whole person and their experiences with men and cis men in particular in the wider world, it's harder to say no to you guys than you think it is.
Good. That's awesome.
Thank you so much for
the patriarchy is real, guys.
Testimonial privilege is a thing.
Oh, it's a thing. Yeah. I'm here to tell you.
Yeah. Thank you very much for sharing that. That's excellent.
I think maybe we have time for one more quick question. And I'm apologize that we can't get through all of them. There's so many great questions. If you do have something that you want to follow up on that the college can help you with, you can always email our professional practice team at practice@OCSWSSW.org, and I'll have one of my colleagues put that in the chat for everyone as well. We've been getting a lot of questions about practice settings in virtual spaces and navigating boundaries and consent when you're not physically present to touch a person, but still, how do you have any tips about navigating relationships in a virtual setting?
And I'm just going to say something really quickly that the college discovered over the pandemic that you can sexually abuse clients virtually just as easily as you can in person. And this is because we can be sharing photos or asking people to mutually do things and, these type of things. So boundary conversations in virtual practice is just as important, potentially more, because there's also safety considerations to consider in virtual practice as well. I mean, I've heard people, obviously, intimate partner violence is an issue. Confidentiality can be an issue because you're not sure who else is in the room. I've heard of people, even someone could endorse suicidality and then close the computer, right? So there's a lot of those thought processes. So by all means, I could go on about that for a very long time. I do want to provide our panelists an opportunity to respond to that. But if you've got further questions, please do reach out to the practice account, as Haley suggested.
So if you're running groups, then you do the group norms. And again, there's what you present on camera that can be addressed in your policy, right? So again, if you work for an agency or an institution, typically they would have already guidelines when it comes to providing service online. And that Christina mentioned safety concerns. And so what we usually do, we do a check-in before they join the other group members so that we get to assess if there's SI and HI, harm, if there's potential for harm. And so if there is something that they're not ready for group, then we get to take care of that. So, but for private practice, I have a sheet with, criteria for joining. And that, again, is about how you present yourself, because as we had said, we're modeling behavior. So therefore, I'm not going to wear an AC/DC t-shirt. So I'm still going to remain professional, even though I may be practicing from home. So again, it's just having these standards of practice in place. And that way you can't go wrong. And then, as Christina had said, there's guidelines.
I like ACDC.
I really thought you were gesturing tube tap. Yeah.
So I was like, okay, Constantine, are we here?
Also not appropriate.
I think just being more aware, like we've been all saying, of your language, what's going on. Don't share pictures, of yourself wearing two tops or whatever. Just being respectful, of yourself, whether it's online, offline, and just being aware of, and, of your audience. Again, setting those boundaries right from the beginning, no matter whether you're offline, online, in person, and being able to have those conversations, as difficult as they may be. You're the role model, when these difficult things, issues come up, these difficult conversations, you need to take that step and you need to be able to address them in a good, healthy way, and not the client bringing them up. And as Alistair had said, as difficult as it is, bring them up, have those conversations, let it be a teachable moment. Online may be safer than in person, for some. So if you're more comfortable that way, then fine. But you need to be able to do it in person as well. So, just don't be sharing stuff online. Yeah.
Thank you, Mary. Last word?
I guess maybe the last comment I would like to share is just the sense of when we talk about boundaries, again, just us being the service provider, implementing those boundaries, right? So if, we're having a virtual appointment and our client is getting their hair done, or, they're with their partners in their bedroom, which I've had, or, they're on the bus, or they're waiting for another appointment. I think this is where, it's helpful for us to, again, maintain the professionalism to say, this seems like it's not a good time for us to have this meeting, right? Let's reschedule for another opportunity. And when they say, no, it's okay, again, reminding them this is a therapy or a counseling session, right? And I again validate and appreciate that you feel safe enough to have this, conversation when you're getting your hair done. And yet at the same time, it's just not appropriate, right? And so again, kind of role modeling the professionalism around that.
Yes.
I kind of just got a bit of the ick when you had just shared. I know that. We don't need to share things, you know, like I might come on online makeup free, but you know, but no, none of that. But yeah, I guess that would be the one thing that I would like to sort of share.
Role modeling the professionals.
Yeah, role modeling.
Can I just add one more thing in what you're saying? You know, it brings up, you know, like as helping professionals, we need to be aware of what is out there and what you're putting out of yourself on social media. If you're going online and you're all drunk and you have these TikToks and, you know, because I've seen that where there are some helping professionals and they're out there and they're driving and they're all, you know, that first of all, that's against the law to be having your phone. You know, the other is where you're in.
Yeah.
You know, obviously intoxicated, doing the licking and you know, stuff like that. Like, you know, you be respectful to yourself. You know, you're the role model, you're the helping professional. So be aware of what you're also putting out there on social media, you know, your posts and that. So
Great point. And thank you for doing my job for me. Yeah, appreciate it. Promise that wasn't scripted. Thank you, everyone, so much. And thank you to our fantastic panel. This concludes our 2024 Educational Forum. And on the behalf of the college, I would like to thank Constantine, Alistair, Melanie, and Cheng. Thank you all so very much for your insightful contributions and this really riveting and fun and entertaining conversation, even though at times it was a bit of a difficult, heavy topic, right? So thank you for bringing that levity to this really relevant topic. And I'm sure that this is going to spawn more conversations of a similar nature. Thank you so much to everyone who watched today. We hope that you were able to make the most of this virtual event. I'd like to remind attendees that you will receive an email later today asking you to complete a post-event feedback form to share your experience of the event. Once you complete the feedback form, you will have access to a link to the certificate of participation for your records. Thank you so much.